Good afternoon and welcome to today's webinar, Early Access Services and Supports for Infants and Toddlers with Social Communication Delays, brought to you by the University of Iowa Division of Child and Community Health, Child Health Specialty Clinics, and the Regional Autism Assistance Program. I am Shawn Whitrock and I'll be moderating today's session. The session will be recorded and a link to that recording will be provided in an email following the webinar. You are free to type your questions in the Q&A box throughout the presentation, and those will be answered at the end of the presentation. CE credits will be available for those attending the live session today, and directions for obtaining those credits will be shared at the conclusion of today's presentation. I am pleased to introduce and welcome our presenters, Tonya Krueger and Wendy Trotter. Tonya Krueger is a registered dietitian, nutritionist, and early access program coordinator for Child Health Specialty Clinics. She has 20 years of professional experience, and her work in Iowa has included roles within Head Start, the dietetic internship program at Iowa State University, and early access. She lives in central Iowa with her husband and daughter and enjoys gardening and cooking. And Wendy Trotter is an education program consultant for autism at the Iowa Department of Education, where she has over 8 years of experience supporting statewide capacity building efforts to support educators and providers in the area of autism and social emotional competencies. She is a speech-language pathologist who specializes in autism spectrum disorders and has over 27 years of experience working with individuals with disabilities and their families in a variety of settings, including pediatric rehabilitation and diagnostics, early intervention, public school settings, and non-public or special school settings. Without further delay, I will turn the presentation over to Tonya and Wendy.
Hello, thank you so much, Shawn. Since Shawn did such a nice job introducing us, I won't spend too much time doing that, but I'm Wendy Trotter and my colleague Tonya Krueger. And today we are going to be hopefully helping you to recognize the importance of early intervention and the system of care that's available in Iowa around early intervention. Describe the process for early access referrals, determining eligibility, and then the services that are available through early access. And then to spend a little time kind of understanding social communication delays and the benefit of early intervention and family-guided routines-based interventions. So let's start. Why is early intervention important? A baby's brain is developing the most rapidly during the first 3 years of life, when more than 1 million new neural connections are formed every second. The basic architecture of the brain is constructed through an ongoing process that begins before birth and continues into adulthood. Both genes and the experiences a child has during this time will shape the architecture of their brain and build the connections that allow them to develop lifelong skills like problem solving, relationship building, and language or communication, skills that will allow them to thrive in their family, school, and community. One of the most essential experiences in shaping the architecture of the developing brain is serve and return interactions or reciprocal interactions. Between children and significant adults in their lives, babies and young children naturally reach out for interaction through babbling, through facial expressions and gestures. And then the adults respond with the same kind of vocalizing and gesturing back to them. So we get this back and forth serve and return interaction. This back and forth process is fundamental to the wiring of the brain, especially in those earliest years. So we're going to watch a brief little video that will further explain this process.
The key to forming strong brain architecture is what's known as serve and return interaction with adults. In this developmental game, new neural connections form in the brain as young children instinctively serve through babbling, facial expressions, and gestures. And adults return the serve, responding in a very directed, meaningful way. It starts very early in life, when a baby coos and the adult interacts and directs the baby's attention to a face or hand. This interaction forms the foundation of brain architecture upon which all future development will be built. It helps create neural connections between all the different areas of the brain, building the emotional and cognitive skills children need in life. For example, here's how it works for literacy and language skills. When the baby sees an object, the adult says its name. This makes connections in the baby's brain between particular sounds and their corresponding objects. Later, adults show young children that those objects and sounds can also be represented by marks on a page. With continued support from adults, children then learn how to decipher writing and eventually to write themselves. Each stage builds on what came before. Ensuring that children have adult caregivers who consistently engage in serve and return interaction, beginning in infancy, builds a foundation in the brain for all the learning, behavior, and health that follow.
So as you just learned in this video, social interaction and engagement with other people, or this serve and return interaction, is critical for building the foundation of brain development. But for some infants and toddlers, developmental delays and/or genetic differences, such as with autism, may make it more difficult for caregivers to engage their child in this reciprocal back and forth interaction, which can then have a cascading effect on their development and learning. This is why early intervention is so critical. For children with developmental delays, intervention is likely to be more effective and less costly when it is provided earlier in life rather than later. High-quality early intervention services can literally change a child's developmental trajectory and improve outcomes for those children, but then also their families and communities. Children's social, emotional, and physical health is essential for school readiness, academic success, and overall well-being. When young children do not achieve the milestones linked to healthy development, they are at risk to do poorly in early school years and then in their future academic and/or workplace environments as well. Additionally, early intervention supports empowers families and caregivers to better help their child develop and learn. It can increase a family's confidence as well as their competence in knowing how to support their child's unique needs. So to help determine if a child has a developmental disability and could benefit from early intervention, the American Academy of Pediatrics recommends a combination of both developmental surveillance as well as developmental screening. It is this combination that is best to promote healthy development, prevent delays, and identify children with delays and disabilities as early as possible. Developmental surveillance is flexible and ongoing and is an important way for clinicians to identify children at risk for developmental delays. Surveillance is something a healthcare provider should do at each health visit. There are 6 components of developmental surveillance. First, ask the parents about their concerns and then take a developmental history. Observe the child in the office and attempt to engage in the child. See if you can get some of that back and forth interaction. Then identify any risks as well as strengths and protective factors, and then document those results and your findings. And then most importantly, communicate your findings and concerns with other providers, whether that be other healthcare providers, early intervention providers, but make sure that those findings and concerns are being communicated. Another piece, encouraging parents to complete developmental checklists can help with this developmental surveillance process during office visits. If parents can complete a variety of checklists, such as the CDC's Learn the Signs, Act Early materials, or their milestone tracker app that they have. There's another, we're going to talk a little bit later, Baby Navigator has social communication growth charts. There's also Autism Navigator has a checklist of the 16 early signs of autism, and there are many more parent checklists out there. But if parents can be completing some of these checklists and bring those concerns with them to a health visit, then that would aid in that developmental surveillance. It's also important to note that surveillance is not screening, and it should not be thought to take the place of a validated screening tool. Think of surveillance as working together with specific screening tools. So speaking of developmental screening, on the other hand, involves using a validated standardized screening test, or also called a screener, and it is used to supplement and strengthen ongoing developmental surveillance to identify those subtle risks for developmental delays that parents and pediatricians may not recognize during routine interactions. According to the American Academy of Pediatrics, general developmental screening tests should be conducted at the 9, 18 and 30-month health visit or well-child visit. Then autism spectrum disorder screening tests should be conducted at the 18 and 24-month health supervision visits. And then screening tests should also be administered when a clinician or parents or an early childhood professional have any concerns during surveillance or any time that concerns arise. It's important to remember that it's the combination of surveillance and screening that provides or that improves early detection. Developmental surveillance and screening together are more likely to help identify the 1 in 6 children with a developmental disability than either one could do on its own. So identifying these children is important so they can receive those early intervention services that help improve those skills, abilities, and future performance and later success in life. So what do we do if a family or provider has concerns about their child's development? This is where early intervention or early access comes in. And I'm going to turn it over to Tonya, who's going to talk a little bit more about early access.
All right. So what is early access? It's Iowa's statewide early intervention system. It's our system of services for families with children birth to 3 years of age that are not developing as expected, or they may have a medical condition that can delay typical development. This program is required by the Individuals with Disabilities Education Act. And as Wendy talked about the importance of early intervention, early access focuses on helping parents and other caregivers so they can support their child's growth and development during those everyday routines and activities. Early access services are provided at no cost, and this is a voluntary program. It is truly family-centered. Families are involved in the process from beginning to end as they work through all the pieces that are involved. There is much more information available for both families and professionals about early access on the Iowa Family Support Network website, and I'm going to spend a little bit of time highlighting some of those features for you. Next slide. So let's look at the system. There are actually multiple agencies that work together to deliver early intervention services in Iowa, and that makes up early access. This includes the Iowa Department of Education, the Iowa Department of Health and Human Services, Child Health Specialty Clinic, and Child Health Specialty Clinic, and these are the signatory agencies. These agencies have a memorandum of agreement that formalizes their commitment to the system. So everybody has a different focus. Within that, the Iowa Department of Education is our lead agency, and they oversee fiscal and legal responsibilities. The Iowa Department of Health and Human Services, now combined, provides systems level expertise through 2 of its bureaus. The Bureau of Early Intervention addresses social services specifically related to mental health and developmental disabilities, as well as child welfare and Medicaid. And the Bureau of Family Health focuses on infrastructure building activities, health policy, child health promotion, and prevention practices within the early intervention system. Child Health Specialty Clinics provide system-level expertise in clinical health and family navigation, as well as service coordination and nutrition services. Iowa's area education agencies are responsible for the administration of those services across the state. So you can see here on the map that no matter where a family lives in Iowa, those services are available. So we do have 9 AEAs in Iowa. And so you can see those on the map. Starting in the northwest corner, we have Northwest AEA, and then moving across the state to the east, we have Prairie Lakes AEA, Central Rivers, and Keystone. And then at the bottom southwest corner, we have Green Hills AEA. Heartland is in the center part of the state. Great Prairie is in the southeast corner. And then we have Grantwood AEA and Mississippi Bend AEA. So you'll also see on this map, I've indicated where we have CHSC offices. And since we do provide some of those services, the offices that house service coordinators or our dietitians are indicated with a gold star. So we do have other CHSC offices where we have other providers that also support children in early access, and they may be supported through family navigation or clinical services, and you may be familiar with those as well. Currently, we have 9 CHSC early access service coordinators, and they support teams in 7 of our AEAs. The AEAs also have service coordinators that support families as well. So we have a variety of ways that we connect with them. We also have 3 dietitians that are in our Bettendorf office and another dietitian that works remotely out of the Iowa City area, where our administrative office is as well. And these dietitians are able to serve children across the state in all the AEAs through the use of telehealth. We'll take a look at those specific services that are available. There are a variety of services, and these services are really what is included or what is offered or provided is based on the child's needs. So I have some common services listed here, but this slide is not an exhaustive list. There's more information about the early access services, and that's available on the Iowa IDEA information website. The link is included on the slide here. But we have a variety of professionals that may be involved in a team supporting a child and family through early access. This includes developmental specialists, early childhood special education teachers, occupational therapists, physical therapists, speech language pathologists, registered dietitian nutritionists. We also have teachers of the deaf and hard of hearing, teachers of the visually impaired, and audiologists. You'll notice that there are autism-specific services available with our autism resource. There may be a variety of therapists that are involved in supporting those children as well. It is interesting to note that most providers do work for the local AEA, and that's where we have all those agencies involved in this system. Child Health Specialty Clinic does provide nutrition services, and then our teachers of the deaf and hard of hearing, as well as teachers of the visually impaired, are part of the Iowa Department of Education, and they may actually serve families in more than one AEA. It's also important to know that all families are going to work with a service coordinator. They will be contacted by them upon referral, and then additional providers will be included in the process. So with that, let's go ahead and take a look at some of those kind of key points of accessing those early intervention services, which is early access. So there's information about making a referral, what is entailed in eligibility, as well as more specific information about services and what that looks like. Again, this information is available on the Iowa Family Support Network. It's very easy to make referrals through the website. There's a form that you are able to fill out, and that can be filled out by parents or other professionals or caregivers. Referrals can also be made over the phone, and if you go to the link, you'll see the contact information for that as well. So once a child is referred, they'll be contacted by a service coordinator in the area where they live. And that service coordinator is going to work with the family as well as other team members to determine if a child is eligible. So a couple things that we're looking at, a child may be eligible based on a diagnosis. So if they have a diagnosis of autism, they would automatically be eligible for early access services. Or maybe a delay is identified. So this process is going to include a review of records as well as developmental evaluations. And then once a child is determined eligible, again, those services are provided at no cost to the families. And this typically occurs through regular visits in the home or other community settings. And that is something that sets early access services apart from other therapies that might be provided or available in a clinical setting. So with that, there are specific handouts that we have available on the website that just explain the process a little bit more. So this handout, this is just part of the handout, it provides information about those developmental milestones, as well as information of how to make a referral to early access. So this is helpful. It doesn't matter where a child lives, as long as they're in Iowa, they can use the same portal or the same online application to enter that referral, and it will automatically go to the area, the team that serves the area where they live. So as you can see here, we've kind of highlighted different developmental milestones that would be typical for a child, and it may include concerns with talking, moving, seeing, hearing, listening, thinking, eating, or playing. And Wendy's going to spend a little bit more time talking more specifically about some of those that are related to social communication. We are now going to spend a little bit of time hearing specifically from a parent and their perspective on referrals.
My advice to any providers out there would be, as both a mom who's been on the parent side of early access services and as an educator who's been on the other side of those services, that if you have any doubt in your mind whatsoever, if there's anything you see that says, oh, I wonder if we could intervene, if there's something that a teacher's eyes could get a look at to see what could we put in place, let those families know that this service is there. It has nothing to do with their insurance, with their medical background, things like that. When in doubt, just call. It's such a great process that they use to help determine, is there an ongoing need? Is this a consultation? Is this an intervention? Or is this a child who needs those supports and services in place for a shorter long-term basis to help that child continue to make progress and growth?
Okay, so that's directly from a parent, just the importance of making a referral. So once that referral is made, we have another handout that explains a little bit more specifically that evaluation process or that eligibility process, as well as different providers that may be involved, and then some of the contact information or expectations for visits. So this really looks at that process, and you can see here there are 5 main areas of development that will be reviewed if we are looking for a delay. We're going to look at those 5 areas. So that includes the cognitive area, communication, physical, social, emotional, as well as adaptive. And that really relates back to the talking, listening, seeing, hearing, thinking, playing, those things. That eating would be in that adaptive category. So this really does include a very comprehensive evaluation, and that information is going to be very important, not only for determining eligibility for services, but then also identifying appropriate supports and developing the plan for the child as well. So moving forward, looking more specifically at those services, providers are going to implement evidence-based practice. This is what we call family-guided routines-based intervention, or FGRBI. And the center of this is really that coaching model. So the caregiver is involved in the process really from the beginning, from referral and moving forward. It's intended to make sure that everything is based on the family's priorities and concerns. And the providers are going to coach caregivers to engage their children in learning throughout those everyday routines and activities. So they're going to make sure that things are appropriate for that family. They're going to look at what the family is doing throughout the day and incorporate strategies that fit within their environment and their home and their structure. They're also going to make sure that they're using evidence-based interventions, so things that have been shown to work. And all of this is going to be addressing outcomes. They want to make sure that a child's functioning is being improved and enhanced, so that they are able to interact and participate, again, in those everyday routines and activities. So with that, we have another handout that's available on the Iowa Family Support Network. And this is a way for families to understand what a home visit or what a session would be like when they do receive early access services. It really highlights the importance of that caregiver's participation in the coaching sessions. So throughout the visit, parents are engaged. They're encouraged to celebrate progress, ask questions, discuss concerns that they have, as well as participate in activities with their child. It truly is a hands-on session. That parent or the caregiver is going to be involved in setting the stage, as well as kind of allowing the provider to observe them and interact with their child, and then work through some problem solving and planning, identify ways that they may be able to enhance development, and then also look at what worked, what didn't work, and develop a plan that is in place in between sessions. So it really is important for families to understand the value of their participation in these visits, and how they are really going to make a difference and support their development by the way that they are just going about their daily routines and activities. So all of this is recorded in the Individual Family Service Plan, or an IFSP. This includes the outcomes, so it might be specific to the child, or it may be related to the family and what they desire for their family and their child as well. And this is also going to include the type and the frequency of those services. So the list of services that I showed earlier, this is going to identify specific services that are provided and how often those will be provided, again, based on the needs of the child and the family. These outcomes and services can be adjusted and modified as needed. There's ongoing progress monitoring, and so it's important that the priorities identified by the family initially, that those are being met, and then as things change, that can be adapted as well. So this is an important plan, but it is also flexible, and it is constantly available for modification based on the ongoing needs. So with that, we're going to hear from another parent.
I think that early access, especially with the Keystone AEA, our team that we've had has just been like astronomical. It's completely changed how we look at physical therapy and occupational therapy. It's no longer just this one event that we do at the hospital. It's become an entire part of our day. It's an interesting way of looking at how to make this a part of our lives. And so I think that for anyone who is thinking about using early access, that it has just been nothing but good for us. It's created an environment where we can ask questions about how to do things better, especially like everyday little activities. And to be honest with you, when we first got referred, I just thought it was going to be like a physical therapist and occupational therapist coming in our house, and we would just, do strength training and reaching, and it would just be this one little time. But it hasn't been that at all. It's been like, hey, so you have this issue. Like, for instance, my daughter has a hard time sitting up in the bathtub. So we talked about ways in order for her to continue to sit up in the bathtub, but, like little interventions that we can do so that she feels more safe and she's able to do it better. I think that it's kind of amazing what you don't know until they come into your house. And then you just look at every single little piece of furniture or shelf or anything, and you start thinking like, oh, I can use that in order to help my daughter get better and to get stronger. And it's just kind of this, it changes the way that you look at your environment. It changes the way that you look at the problem that my daughter is having. It changes the way that we have gone about this entire journey, to be honest with you. I was thinking, okay, we do physical therapy and occupational therapy at the hospital, and then I'll try to do it at home. But it's like, no, throughout the entire day, we are constantly doing activities, because I think that early access has really opened our eyes into all the opportunities that you can do throughout the day. Something as simple as getting her dressed. That is now an activity that we do that helps her get stronger and works on all these different therapies that don't have to be regimented. It's literally throughout the day that we do them. So I think that being referred to early access has really just changed how we look at the future and how we go about making sure that our daughter gets better, because we have these therapists who come into our house who help us look at what we can do in our home and help problem solve, which has been really a huge benefit and huge help for us.
Okay, so sorry, I hid my meeting controls and then I had to escape, which took me out of the slideshow. So jump back in. So we spent a little time kind of setting up what early access is, how you access it, what it does for families. So we're going to shift a little bit and we're going to start talking about some of the early signs of social communication delays, and then we'll tie that back into what early access can do to help with that. So good communication development starts in the first year of life and goes far beyond learning how to talk. As we briefly saw in that very first serve and return video, before a toddler utters their first word, they learn to socially interact with their parents and their caregivers in those everyday routines and activities. These skills are what we refer to as those key social communication milestones. There are a number of resources that are available to assist parents and professionals alike to track developmental milestones of children. And these are just a few, just highlighting a few. So I mentioned it before, the CDC's Learn the Signs Act Early, and they offer that free milestone tracker app. 0 to 3 is a national nonprofit organization that has a website with a lot of materials for professionals and parents. And then the American Academy of Pediatrics has some great milestone trackers on their website as well. But most of these are kind of looking at that broad developmental milestone. So we're looking at all aspects of a child's development. But what I want to key in on today is specifically looking at those social communication milestones. So most parents and professionals know the early motor milestones. They know that children should be sitting up around 6 months and crawling around 9 months and maybe walking around 12 months. But few parents and professionals really understand a lot of those key early social communication milestones. But these milestones offer a critical window into the well-being of infants and toddlers and are the earliest signs of healthy development and school readiness. So what do we mean by social communication milestones? Social communication skills give us the tools that we need in order to effectively interact with other people. And if you remember from that serve and return video, that interaction, that back and forth interaction is critical for brain development. So families usually expect their children to begin talking around their first birthday, but they may not be aware that these social communication skills develop well before and then along with the use of words and spoken words. So before children learn to talk, they use eye gaze and facial expressions and sounds and gestures, such as giving and showing and reaching and waving and pointing. They use these to in their social interactions with their caregivers and family members. Children might look back and forth between a parent and an object they are interested in. So if they see something, they might look at their parent and look back at the object, trying to draw their parent's attention to that object. They also may follow a parent's gaze. So if a parent looks at something or points to something, then the child's going to turn and look and see what it is that the parent's trying to show them. So they're not only trying to draw their parents to something of interest, they're recognizing when their parents are drawing them to something of interest. So these are some of those early skills that we may see. Children also may look, point, and vocalize to show that they want something or that they see something. So let's look at an example. If we're blowing bubbles with our child, the child may clap in excitement, showing and sharing that they are excited about this activity. They may point or reach for the bubbles or for the bubble wand. They may look at the parent and smile to show pleasure in that activity. They may squeal. They may utter, baba. They may make noises and sounds and vocalizations or word approximations. And they may even request more if they've been learning some early signs. So there's lots of ways in that little activity that we're going to get some of that. We're going to see some of those early social communication skills. Those first smiles, those sounds, those movements, gestures, and words are especially important social communication milestones because they help that baby connect with their caregivers or parents and with the world around them, making them available for learning. For many children, delays in social communication are the first sign of a language delay. So if a young infant is not engaging in some of those back and forth. They're not watching where a parent's looking. They're not smiling at the parent in response to the parent smiling at them. Those could be indicative of a language delay. It also may be indicative of other developmental delays, including autism. So it's important to catch these delays early when a baby's brain is developing most rapidly and is shaped by the experiences that caregivers provide. Social communication delays can be detected early, even before a baby is talking. So I want to share with you a website, a resource that is available to kind of really help identify and highlight what these social communication skills look like and these early social communication skills. So I'm going to click on the website. And hopefully if you're not seeing it, let me know, but hopefully you're seeing it. So this website has a plethora of information, and I don't have time in this webinar to go over everything that's available in here. I just want to highlight a few things. So I'm going to go over to the menu over here, and we're going to look at how do you encourage the magic, and I'm going to go down to specifically learn the milestones. So those are going to be these social communication milestones that I'm referring to. They have a really great little short film that kind of really demonstrates what some of these early social communication milestones look like. And there's a trailer that kind of shows resources that they have available to families. And so I'm going to come back up to these milestones in a second, but I just want you to know that parents, at no cost to them, can register to be a part of this baby navigator. They are doing some research in this tool and using this, so they can register for it. And then they have access to not just these pictures and descriptions, but also videos that are demonstrating what those social communication milestones might look like. So I just want you to be aware that that's a resource for parents that you can share with families, or if you're a parent, that's a resource that's available to you. So you will see that they have these social communication milestones divided up in months. So it goes anywhere from 1 to 2 months all the way up to 23 months, or 24 months, I'm sorry. So if we click on 9 to 10 months, for example, you can look at it this way on the website, where they have it divided into 5 domains. You'll see these domains. So we're looking at language, we're looking at play, we're looking at social interaction, we're looking at emotional regulation, and then we're looking at self-directed learning. And it will describe what are some of the things that a child should be doing in that 9 to 10 month range. So they should be using some early gestures like giving and reaching to get you to do something. They can be explore objects and repeat different actions with objects, or they enjoy and anticipate your actions in play. So if you're doing a little play routine, they're enjoying and anticipating those actions. And so we go all the way down to self-directed learning. You know, they will listen to your voice and guide my actions. But there's also, I think this is the key piece. This is a handout that's available that you can print, parents can print, and they can have a further illustration of all of the examples of what this might look like for this 9 to 10 month range. And so these are available at every one of those age bands. So this can be something that is printed. If you're a provider, you could have some of these printed ahead of time, and then you could give these to parents, and they could be kind of tracking these and bringing these to your to their health visits, so that it can aid in that surveillance piece that we talked about earlier. I'll show you that we also so here's an example of 19 to 20 months. So it's a similar kind of a thing, but it's going to look different because what the expectation is for that age is different than what we would have at that 9 to 10 month age. So these are available individually in those age bands. Or if I go all the way back to our original website, I'm going to scroll down to the very bottom. There's a whole section of resources that are listed here. Some additional checklists that I mentioned or referred earlier, like the checklist of the 16 early signs of autism. But if I go to the Baby Navigator resources, and then I scroll here, there's this milestones that matter 1 to 24 months. This is all of those age bands together on one document. So this is a great resource that you could have printed and available, like just on the office wall, or that parents could have access to, so they could kind of just keep track, that ongoing watching how their child is developing and what those social communication skills should be that they're developing. So that if they're not showing some of these things, that may be an opportunity for further conversation, screening, and evaluation to determine if they could benefit from early intervention services. So I just wanted you to be aware of that resource. And I think, like I said, I would love to go through and show you all the videos and stuff that are available on this website, but we just don't have time for that today. But I do encourage you to check out this resource, the Baby Navigator website, because it's got a lot of great materials for parents specifically, but providers as well. So I'll go back to our presentation slides. So if your child is exhibiting some social communication concerns, if you're using these checklists, you're using other checklists, and you're seeing some concerns about their social communication skills, what do we do? Well, the first step, obviously, is to make a referral to early access. As Tonya was sharing before, that in early access in Iowa, providers focus on the evidence-based practice of family-guided routines-based interventions and caregiver coaching. So in this model, early intervention providers go into a family's home and they work with the family to help them learn how to best help their child. So they do this by coaching caregivers to embed supports and strategies to engage their young children in learning as they participate in their everyday routines and activities. So like that parent explained, she began to realize that everything they do was an opportunity to embed some of these strategies to help them grow and help them learn. The providers go into the home, and then they're not bringing their own toys. They're working with what the family has available to them. So those are some key pieces to early intervention and that caregiver coaching component. So why coach caregivers? Why not just provide therapy to the child? Well, I want to use this popular analogy to kind of explain the benefits of coaching caregivers. So in this picture, the single marble on the left represents an hour a week that a family may have with an early intervention provider, which is common for most families who receive early intervention until they enter preschool. The jar on the right has 167 marbles that represent the 167 hours that go by until the child's next intervention session. So what matters most is the time that a family has between intervention sessions, and that parents and caregivers can make a bigger difference in their child's success than that parents and caregivers can make a bigger difference in their child's success than an interventionist who comes just once a week or even a few hours a week. So if the parents are equipped with the skills that they need to help their child learn and grow, we're going to see greater progress for that child. So if a young child is exhibiting some social communication delays, often early intervention will start by focusing on something we kind of refer to as active engagement or social engagement. And this is because, as brain science has taught us, children need to be engaged with other people in order to build those neural connections in the brain and allow for other brain growth. So what do we mean by active engagement? Active engagement means a child is socially connected and ready to interact and learn. It means that they have a productive role in this back and forth interaction, that they realize that they are a part of this process, and that they are able to communicate in one way, shape, or form with others around them, and that they will hang in when faced with challenges or change. So if something, it kind of changes their goals, they're not going to just dismiss interacting with people and go back to playing with just toys, that they're going to kind of hang in and realize the importance of that back and forth interaction. So you can kind of think of active engagement as a layered cake, with that first layer being that foundation. So initially, before anything else can really happen, before we can build on those skills, they need to be well regulated. They need to have kind of that productive role, something that's keeping them engaged, and they need to be socially connected to people. Once that's in place, then we can start looking for them to begin looking at faces, to communicate, to initiate, to be responsive to social bids for attention. And then they can begin, initiating their own ways of communicating, whether that be through a glance or a gesture or a vocalization or a word. And then once we have those things in place, then we can begin building that flexible generative language. So if we had a cake that had huge holes in it and we didn't have all of those pieces together before trying to work on helping a child talk, because often, parents or families may be referred to early access because they're not talking. And so they're like, well, we want to work on them talking, but we have to kind of get these foundational skills in place before we spend too much time trying to get them to talk. Because if there's holes and if we have an unsteady foundation, then it's not going to be the best set of skills for that child moving forward, and it will not set them up for success. So I want to share with you a video of a coaching session. This is a early interventionist who is working with a parent whose child has social communication delays and they have some red flags for autism as well. You'll see this is Anthony, and he is just right a little over 2 in this video. And Anthony definitely has a preference for toys, objects over people. And so one of the things that they're really working on is just trying to get him to be more socially connected. And so some of the strategies is they're trying to build in some play routines and build in a predictable routine with that play. And so you'll see the coach or the early interventionist coaching the caregiver, the parent, the mom, to kind of see what they can do, what's going to work, what's not going to work, to kind of help really promote that social connection and that initiation with Anthony. So I have to escape out of here to go to this other video. Oops, I'm sorry, what's one?
Are we all, you want to try it? You think we can go
Do one more time? One more time.
Okay, here comes Tower. So we'll do the ready, set, and then wait. I'm going to try my best to cue him into what you're saying. Okay, last tower. This really is the last one.
Building a tower. One, two,
Anthony.
Look! Oh my goodness, it's a big
So I'm going to have
tower.
it stay still. If you'll pause before crashing, just give it like a 3-second wait. And let's see if we can get him shifting his eyes over to you.
Peekaboo.
Here's the last tower.
Peekaboo.
And then we'll play peekaboo, okay?
One more tower. Put it on.
On top.
Okay.
Okay. And I might
Ready,
Ready?
set.
He actually looked up to me. Ready?
Set. And
Go, go, go. Go, go, go.
let me crash. Crash.
Oh, crashed down. He actually did a quick little look to me, said the position we'll have to play with.
I was trying to get back in the position I was in previous times, thinking.
Yeah, I think he's going to get into that though, but it's a different kind of play for him. He doesn't do a whole lot of building and constructing. So blocks is a good one to pull back into his inventory in terms of your everyday stuff, because he could sure be interested. So all those little setup phrases that I know you've seen us use in the playroom, the ready, set, go, or the 1, 2, 3, go, and giving him a word. So remember with the parachute, he would like fill in the shake, shake.
Yes.
And we did ready, set, and I think he's even done a little bit of a go
I think
before.
so. Try.
I haven't seen it consistently yet. So 1, 2, 3, go, or ready, set, go. It could be that before he can shift over to you, he can at least put the word in.
Okay, so in that video, you saw that, so the provider was in the home, in the family's home, using their toys and their materials, and the focus was on coaching mom to know how to elicit that social connection through some motivating activities and predictable routines. And even they talked a little bit about positioning to ensure that she was in a place where it would be easy for him to try to briefly initiate some of that social interaction. And then moving forward, they're going to be looking for ways to foster opportunities for the child to build their social communication skills through these routines and these predictable processes, by looking at faces, gesturing, and vocalizing to kind of keep that routine going. So she talked about they had done a parachute activity before, and they kind of would do the activity, they set it up, you're ready, set, and he knew that the next thing was going to be shake, 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 so he would shake. So those kinds of things are things that the provider will kind of help the parent to figure out what they can do, how they can build these into their everyday routines and activities to really foster those opportunities to build those social communication skills. And get back to our slides. So as you can see, there are a lot of benefits to coaching families, even, giving them, empowering them to help know how they can help their child. I won't read all of these to you, but overall, a parent who has been well coached is able to reflect and make decisions about what strategies they could use to support their child. And coaching builds that long-term capacity for the caregivers, building their confidence and their competence, which allows them to take action steps between early access visits or in the future when their child no longer receives early access services after they turn 3. So coaching the caregivers really empowers the parents to know how they can help their child learn and grow long after they age out of early access. And to summarize, or in closing today, I just want to share a parent's reflection. I would like you to listen to this parent's description of the benefits of early access for her daughter, who was exhibiting social communication delays and later received a diagnosis of autism. And then we'll talk briefly about that before we move on to questions.
This message for people that do work with children every day and that are often with them, and the parents may not be with them, to see these things as consistently as like a daycare provider or a doctor, or they might not have the warning signs or know the signs of needs for delays in children, is to speak up and definitely say something. Early intervention, I think, completely changed my daughter's path. I don't think she would be where she is now, speaking, reading, saying words I never could have imagined her saying if I didn't get that early intervention. I think she'd still be regressed and she wouldn't have the capability of communicating her wants and needs. A child does suffer if they can't tell you. There's a lot of frustration. My daughter was a very angry, tiny little person because she couldn't tell me what she wanted. And then once I built that communication with her with a great team, she was a fantastic, happy child that I could never imagine going back to where we were 2 years ago. It's fantastic to see what early intervention has done for her.
So I know this parent talked about how important early intervention or early access was to her child's development, but I also hope you noticed how early access empowered her to know how to help her child. She literally said, once I built that communication for her, meaning for her daughter, with a great team, she said, I built that communication with a great team. So by coaching the caregiver, she was empowered to help her child learn and grow and to change her daughter's developmental trajectory. So that's the power of early access. That's the power of early intervention. So there are a number of resources, and you all will be receiving the PDF of these slides. So you'll have access to these websites, the links to websites. There are some that are embedded throughout the presentation, and then there's just a few that we wanted to kind of highlight on a resources page. So I won't spend time talking about them all, but you will have access to those when those slides go out to you following this webinar today. So now I'm going to turn it over to questions. I think there's been a few that have come in the Q&A. I don't know if someone wants to read those to me, or if you want me to go in and find them myself.
So I'll take the first 2 questions, Wendy, and then there's a third one that I'll let you take. So the first question we have is, what is the difference between early access and early childhood when making a referral online? Can I share my screen? Nope. Okay.
Yeah, so I can stop sharing if you want to.
If you go to the website that I referred to for the referral, it says on there, early access is birth to 3. Once a child turns 3, then that early childhood referral would be for children that are ages 3 to 5. So that if you scroll up a little bit, Wendy, if you click on make a referral button, the yellow button, there you go. Yep. So you'll see that it's clarified once you get that far. Early childhood is 3 to 5 years age. So if you fill that out, that will go back, and Iowa Family Support Network will look at that referral, and then they'll identify appropriate supports or programs available in the area, based on the information that was entered. So that was the first question. The next question is, do they have it only in English? So a couple of things. I'm going to answer this a couple of ways. If a family speaks Spanish and they want to make a referral themselves, they can go to the website and they can call, and they can speak Spanish to make a referral on the phone. If you're looking for the handouts that I shared, the links to those handouts in Spanish, we don't currently have those handouts translated, but we do have other materials that explain this, basically the same information that are available to be ordered, that are printed and sent. So if your office is looking for that information, Wendy, if you'd like to go back to Iowa Family Support Network, it's under the professional page, or I can share my screen. What's easier?
Give me a second. I clicked away, so it wouldn't let me click. So give me a second. All right, there we go.
Yep, click on professionals. So the purple, go to professionals, and then there's a section for printed materials. And if you click on that, those are materials that we have available that can be sent at no cost. And if you scroll down, you'll see the handouts that are available in Spanish. So we do have information for those Spanish-speaking families. So hopefully that addresses that question. And then the third question, Wendy, I'll just read it if you haven't had a chance to see it.
Yes, thank you.
The question is, can early access or the AEA providers share autism concerns with parents if they feel that it is more than a developmental delay?
Meaning, are the providers allowed to share? Is that kind of, if that's what we mean, then absolutely yes. So that's been actually, that's been a big initiative since I started here 9 years ago, and in a department of really kind of empowering early access providers to recognize those early warning signs of autism, and then to have those conversations with families and about those concerns, so that they can take those to their primary care providers. So there are some AEAs that will do some screenings for autism, and that might kind of give the families the information that they need to take back to their primary care providers. Sometimes they may refer them to child health specialty clinics because some of the clinics will also provide screenings. They can do stat screenings and things like that. So but yes, absolutely, they can share that information with families if they are identifying some red flags, and they should, right? I mean, that's as if you're seeing concerns and you're seeing red flags for an autism spectrum disorder, that information should be discussed with the family. Sometimes it may depend on whether the family is ready to hear that, and if they're open to taking in that information at that moment in time. And so sometimes I've been an early intervention provider, and there are times where I have shared my concerns, and a family wasn't ready to hear it, and so we just moved. But that doesn't matter. We're still going to provide you services. We're still going to focus on the skills that we know need to be focused on, regardless of whether they pursue that diagnosis or not. And then maybe further down the line they'll be ready to take that next step. So
great. We have a couple more questions that have come in. So the next one is, how can you close the loop and get information back to the primary physician's office? So we encourage teams to have a consent signed so that the family is agreeing that information can be shared with the physician's office. So that's really key in sharing information. We also really try to empower families, to share that information directly as well. But that consent to release information is key in closing the loop with other medical providers when early access is involved. Wendy, I think you might have addressed the next question a little bit. Someone has been told by an AEA coordinator that they're not allowed to suggest or bring up autism. Wendy alluded to the fact that they're really trying to encourage providers to be more open in having those discussions, but then also recognizing where the family's at in whether or not that's appropriate to discuss, where they're at with identifying concerns. So we
and that could be a miscommunication too, or misunderstanding on either part, but that it's that they're not going to be able to make that diagnosis. They're not equipped. They're not able to make that medical diagnosis of autism. But that doesn't mean they can't discuss with the family red flag behaviors that they see and encourage them to then take that information back to their physician to pursue further evaluation. So.
Yep. And then one last question, what can I do to follow up on this with the agency so families aren't missing out on referrals or resources? So it's really important to recognize for early access, referrals can be made by anyone. They can be made by a physician's office. They can also be made by parents. Multiple referrals can also be made. Often we'll find sometimes a referral is made by an office and maybe the family doesn't respond to the call that comes through, or maybe the family says, oh, I'm not interested. But if current concerns come up later, they can re-refer themselves. They can call back and make a new referral. So I really think starting with that referral process is key. We also have within our printed materials the availability of a little postcard to order. And if you make a referral as a provider for a family, you can share that card with them. So to remind them that they are going to be referred and that they should be contacted by a service coordinator. And then there's information on there if they haven't been contacted that they can go ahead and call that number to follow up as well. So it's, lots of opportunities and lots of information is available for families.
As we're wrapping up, I do just want to mention the continuing education credits. So for attendees who would like to claim continuing education credits, the University of Iowa Carver College of Medicine has an online portal to complete the course evaluation and download the attendance certificate. So following the presentation later this afternoon, you will receive an email with step-by-step instructions on how to access that online portal and complete the evaluation. I did put the link in the chat box as well as my email if you do have any questions regarding continuing education credits. And someone commented, thank you so much for this valuable training. And we are at time and I don't see any other open questions. So this will conclude our presentation for the afternoon. And I want to sincerely thank you, Wendy and Tonya, for presenting, and for all of you who attended. Have a wonderful afternoon.
Thank you, everybody.